Pain on the outside of your knee can be one of the most confusing and frustrating things you experience as an active individual or endurance athlete. It may lead you to ask questions of yourself, such as, is this the start of something more serious? Is this the end of my active lifestyle? Does this mean I have to give up all my favorite activities? We'll answer all these questions and more throughout the rest of this video. But my name is Dr. John Schaefer. I'm a physical therapist. I'm a strength conditioning specialist. I'm also board certified in orthopedics, and I work with individuals online to help them overcome their knee pain, and get back to doing all the things that they love. So, my primary objective here is to ease any concerns that you have and just show you that the path to overcoming lateral knee pain does not need to be overly complicated or something that's frustrating for you. So we'll start by addressing a few common misconceptions when it comes to lateral knee pain, including your IT band being the sole culprit that's causing your lateral knee pain, the fact that lateral knee pain is the first sign of knee osteoarthritis, and then finally that lateral knee pain is going to be something that's permanent. Oftentimes it's not. So myth number one, your IT band is causing all your pain. It's the culprit. It's the only thing responsible. This is hands down one of the most common things I hear from patients that I see both in person and online. It's easy to blame the IT band due to its size and the location being right out on the outside of the knee. If it's an area that you're having your symptoms, of course, you'd like to think it's to blame. And oftentimes you might be thinking, the IT band's simply tight. We need to stretch it, right? Well, not quite. It's become clear over the last several years that due to its size and density, we can't actually change the length of the IT band no matter how much we stretch it or foam roll it, mash on it, whatever you want to do. That's not typically the solution. So save yourself some time and hassle and recognize that the primary reason that foam rolling the IT band feels so good is because it's painful during the activity and you're getting relief once you stop. If you're applying a lot of pressure, you take that pressure away. Of course, it's going to feel good when you're no longer applying some of that pressure. But foam rolling can be a tool you utilize, but I want you to think about it differently when it comes to the IT band. So instead of working directly over the tissue like you would for a muscle such as, say, the quads or the hamstrings, we need to work above and below the IT band, focusing primarily on the glutes and then just below the knee, the areas where the IT band originates and where it inserts. Because if you focus on those areas, you can actually increase the mobility of the IT band by decreasing the amount of friction where it's rubbing back and forth. If you're giving it a little bit more space to move by increasing mobility at the hips and then also right below the knee. Again, you're giving it a little bit more room to move. And then additionally, just focusing on things like hip mobility will go a long way in reducing your lateral knee pain. The more mobile the hips are, the less stress that's placed on the IT band. Again, reducing just overall friction in that area. Myth number two, lateral knee pain is always the start of knee osteoarthritis. Arthritis, for whatever reason, is something that a lot of people are afraid of, nervous of anytime they start to have pain, especially as we age. But lateral knee pain, regardless of the specific location, does not mean that you're experiencing arthritis and will need a knee replacement in the next several weeks, months, or years. Outside of bony changes, knee pain can be a result of muscle, tendon, or ligament irritation or damage. Obviously, the older you are, the more likely it is that it is related to bony changes. But even so, arthritis is not necessarily always painful, and it's a natural part of the aging process. And when I educate patients on what arthritis is, I'll oftentimes describe it as simply gray hairs on the bones. Gray hairs for the bones, rather, due to its commonality as we age. But knee osteoarthritis or knee OA typically begins gradually after the age of 50. So if you're, well below that, 30, 35, you don't necessarily have to be concerned about this. But the pain itself may be due to limitations in motion or weakness around the knee joint. And both of these causes can be addressed with strength or mobility work. So you're not broken, and these are all solvable problems, which is good news. Myth number three, lateral knee pain is going to be something that's permanent. So, knee pain, especially if it's new, is often something that can and will improve over time with the right plan. So, I don't want you to panic just yet. Instead, let's think just a little bit about three common reasons that knee pain occurs in the first place. Number one is deficits in strength. So, if you don't have strong muscles surrounding the knees, there's going to be more stress that's absorbed through the tendons, ligaments, and bones. And then repeated stress to these areas is what can cause overuse injuries. Next, we have deficits in motion. So if you aren't often moving through your full range of motion, fully bending, fully extending the knees, the hips, the ankles, the body will naturally become less flexible over time. And if you're not moving into those ranges, this is what can lead to stiffness and pain the further along you go, which you're not moving through those ranges. And then number three, poor movement patterns. So you may have enough strength and mobility, but even so, you may be lacking control through those motions. A common example of this would be landing from a jump. You'd ask yourself, are you able to control the position of your knees or do they cave in? Although the knees caving in or moving inward is not always a negative thing, it could potentially point to a lack of stability or control, which could predispose you to a higher risk of injury. Now that we have some of the common causes of knee pain, we can recognize that these things are, all things that can be improved. We can almost always improve strength. We can almost always improve the mobility at the knee. And we can always work on improving movement patterns and control over our bodies, especially at the knee joint. So you may be able to make some of these changes on your own too. There's hundreds, probably even thousands, hundreds of thousands of videos online with suggested ways to make progress in addressing your knee pain. Depending on your situation, you may see changes quickly, or you may move between multiple suggestions and approaches. If you want more of a concrete plan to get started working on improving your overall knee strength, mobility, and control, I do routinely host 5 day challenges where you can get started. I'm hosting another one this week on Monday, March the 10th. You don't need any equipment, you don't need any preparation, you just need to want to improve your knee health. And I know most of you will probably be seeing this video long after the 10th. Still comment below. You can just comment challenge and I'll send you the information about how to get started. You can get started whenever you want. But basically, each day I'll send you a few videos of me explaining various exercises to improve your strength and knee mobility. Because oftentimes it doesn't take a whole lot to get started, but you just need the right plan and appropriate progression to get started. And the best part about if you do decide to do this challenge, you've got the exercises forever. So just respond, challenge in the comments, and then, like I said, I'm more than happy to send you the information about that. If you have any questions, as always, feel free to either drop them in the comments or you can always follow me on Instagram at johnschaefer.dpt. And I'll have a lot more tips, a lot more suggestions on how we can keep your knees healthy for a long time to come. All right. Hope you're having a great day, and we will see you in the next one.